Hello, everyone. Thank you for attending today's webinar, Achieve Financial Stability Amid Market Uncertainty. Our webinar today is presented by NextGen Healthcare. I'm Brian Eastwood, and I'll be moderating this webinar. We have three speakers lined up today. First is Owen Dahl, the principal of Owen Dahl Consulting. Next, it will be Tyler Surratt, Director of Add-on Modules at TSI Healthcare. And finally, we'll have Mark Miranda, RCMS Specialty Director at NextGen Healthcare. You can read full bios for each of the speakers on the left side of your window by selecting the Speakers tab. I have a few other technical notes before we get started. First, the webcast is being streamed through your computer, so there's no dial-in number needed. For the best audio quality, we recommend that folks turn their volume up pretty high. Next, this webinar is being recorded. The recording will be available on demand within 24 hours after the session has concluded. Finally, after each of the three speakers have concluded their presentations, we will kick it over to a Q&A session. You can submit your questions using the Question and Answers tab that is on the left side of your screen. All right, that concludes the technical notes. Now let's begin. And for that, I'll turn things over to Owen.
Well, Brian, thank you. And I want to welcome everyone to today's webinar. Indeed, a pleasure and an honor for me to be with you today. And I hope what I can do is answer some questions and also challenge you to think a little bit about the long-term financial performance of your practice, and to talk a little bit about value-based care and the complexities that go along with it, and kind of tie the two together as we go through, since this is what our world, as we know it today, seems to be telling us. So, interesting thing here. It says one of my objectives was long-term financial ability or survivability and so on. And what do I start with? What are your costs? And what I really wanted to talk about is the idea of what are your costs today? Because I don't think you can move forward into the future, have long-term success, unless you truly understand what it costs you to do business. I've asked this question over the past 15 or 20 years, and I've had very few people that have responded with a good understanding of what it means to address costs in the business. More focus on the revenue cycle, which is understandable to a degree. But as we look at and continue to evolve through the value-based components of the future, I think costs become very important. So a very simple question: how much does it cost you to see a patient? Well, don't get all muddied up with this and think, well, okay, I see new patients, I see established patients, I see level 2, level 3, level 4, level 5, I see hospital patients, yada, yada, yada. The idea here is let's at least get an idea of what it costs to see a patient. And very simply, you could just take your number of E&M codes and divide it into your expenses and see what that number is. Now, that's not going to represent a new patient or an established patient. It's just going to represent a number. And the point here is to create and come up with a benchmark or a baseline that you can move forward with. And once you understand this and get this idea in mind, then you can ask 100 more questions, such as what are your organizational costs? What are your overhead? How does that overhead kind of fit together? Put it into another context, what is your revenue relationship, or what is your cost relationship with all of your payers? Each payer has an impact on what goes on within your overall organization. So I think that's important to deal with. And what are you doing to manage your reimbursement? And Tyler and Mark are going to talk more about this, so I'm not going to focus on that to any great extent. But I think it's really important that we answer the question: what are your costs, and how much does it cost you to see a patient? How much does it cost you to do that image? How much does it cost you to do that particular procedure? This kind of nitty-gritty detail in the long run becomes extremely important as we think about what our future is relative to the whole idea of the value-based payment model. So if you get to the point of saying, okay, I got some of this understanding, at least I know what costs are, then then we have to go into some things like, well, how is my information generated? How often is it generated? Who reviews this information? What's the source of this? What is or are the sources of the information that we're dealing with? What are your key performance indicators? And we could spend a significant amount of time talking about this. In terms of your key performance indicators, these are benchmarks, these are baselines, these are aspects that are necessary for you to look at. So what's your margin? What's your total margin? In other words, what's your profitability? What's your profitability or margin per payer, per case, per procedure, per visit, per patient? So in order to really gain an understanding of how effective your business model is, your medical practice, it's necessary to begin to understand some of these key performance indicators. And then once you do this, you can identify your key cost outliers, and then you develop a strategy that says, this is what I'm going to do to fix and address those key outliers that are there. You should be looking at this data at least on a monthly basis. And again, who should be looking at this data, how it should be generated, but maybe more importantly is when and who are really critical. And how do you compare this year to date? Do you compare this to last year? Do you compare this to budget? What are you doing, and how do you know that? So if you've developed a good budgeting strategy, then you really have a way of looking at how well you are doing and progressing. And when I say all of this, I'm talking about both in the fee-for-service and the value-based modeling that we would be looking at. In your revenue cycle, obviously payer mix, days, net account, net collection percentage, denial rate, and so on. And again, Tyler's going to talk more about this, so we don't want to spend time there. But now point number one is understand your costs. Point number two is where do you get that information? And then how do I develop key performance indicators that help me identify how well I am doing in relationship to my financial performance? So what are your strategies? Let's stop. And I initially said, let's come up with maybe a challenging thought or two. Maybe there's some information that we're sharing with you today that can be really critical as you move forward. But you need to develop a plan. And obviously in October 27th, it's a perfect time for you to look at your plan, your budget, and everything for the next 12 months, recognizing 2020, a mess, 2021, a mess. Maybe you have to go back even to 2019 or compare 2019 to 2021 in order to really begin to understand that. Now, the challenge then is, where do I cut and how do I cut? What's the most important thing for me to do? And when I say cut, there's obviously the idea here is controlling your expenses and controlling your costs. So you have fixed costs, you have variable costs, you have direct and indirect. And those costs are basically defined as variable costs fluctuate with the volume of activity. Fixed costs will always be the same. So a fixed cost is your rent. Whether you see one patient or 1,000, your rent is going to be the same. Your variable costs are going to vary for that one patient to the 1,000 patients. Your direct costs are those costs that relate directly to the patient services or to your mission and your purpose. Indirect costs are those costs that are associated with giving you support to support your direct costs, support your fixed and your variable costs that are there. So we need to know, so if we were to be challenging each other and say, okay, where do we cut first? Do we cut our indirect costs? Do we cut our variable costs? Do we control our fixed costs? Well, sometimes your fixed costs can't be touched for 3 years because of a lease. On the other hand, your variable costs may be able to be addressed today based on a new contract that you might have from a supplier. A second part of your strategy is your number of patients, your patient flow. What are you scheduling? Am I doing it appropriately? My flexible hours, or should I have flexible hours? Should I open more hours? Should I close more hours? So what do I do to increase my patient flow? Telemedicine and technology is essential and critical as we look at what goes on into the future. And we've seen practices that have said, well, we're going to see patients every 15-minute slots, so we'll see 4 an hour. Well, now with telemedicine, they've actually gone to 5 an hour. So there are different ways that you're able to do a number of things. And this, of course, generates revenue as to where we want to go. But you also want to keep in the background access to lines of capital. And when we talk about this is what capital options do we have? How's my bank? Do I have other sources, other vendor sources that I can use to help me in managing my capital needs that I would have? So we want to talk about these kinds of things as we move forward. Now, what's value-based care? Okay, you've heard that expression, and everyone on the line actually knows what it is. But basically what it is, it's a rewarding incentives for quality of care, bringing value in measuring outcomes versus the cost of delivery. The reason and the pro for this is that supposedly there's a focus on the quality of care rather than on I need to do extra testing, I need to do the extra procedures, I need to do this. So there's allegedly excessive and unnecessary treatments and procedures that are done in the fee-for-service model that are not necessarily related directly to the quality of care that's provided. The con side of this is, well, with value-based care, we have increased regulation, we have restrictions, which limits the knowledge base and the opportunity for a provider to make their own personal decisions. There's a lot of resources that are required to manage the value-based care, which increase your costs. And then the other component of this is a lot of this is based on historical benchmarks. So if you were a very efficient practice initially, it's harder for you to perhaps gain some benefits versus the practice that was totally inefficient in terms of how it works. So value-based care can be seen through medical homes, the patient-centered medical home, through accountable care organizations, which really is an alignment and integration and a data sharing component that has really taken off. And there are some 513 recognized accountable care organizations in the country today that are at least sanctioned by Medicare. So there's lots of things that are there for us to look at and to think about with regard to the accountable care organization. And then supposedly there's this shared savings kind of idea where we should be able to be sharing the savings with ourselves as well as our payers. The AMA says there are 5 steps that are necessary for you to help manage your value-based care modeling. Identify your patient population, obviously are very critical. Identify and deal with that patient population and the opportunities that are there. Design a care model or care models that are around that patient population. And then choose partners that you would like to work with that can lead to success. Drive appropriate utilization and then quantify impact as you move forward. And I like these 5 steps. Again, back to that word I used relative to financial aspects, and that is to develop a plan as you approach what goes on. So patients requiring care, there's some questions that have to be asked. And I don't like to read slides, so I'm not going to read this one. But over on the right-hand side in the little call out, we've got to consider in value-based care 2 different things, efficiency and effectiveness. Are you doing the thing right? And are you doing the right thing? And thing perhaps leads to treatment plans, care models, and that sort of thing as we move forward. So consider this activity and these aspects as you look at what you're doing within your organization. Now, the next couple of slides, I don't want to spend a lot of time on, other than this one just basically says, look, here's the historical perspective of the value-based care programs that CMS has kind of been pushing. All obviously started with the advent of the MIPA program in 2008, but really the ACA program in 2010, the Affordable Care Act, is really what's moved us forward. And then just to really muddy your mind, this is what CMS is dealing with in terms of authorized programs and activities around value-based care. And I like this slide. And unfortunately, again, it's very small, but it requires you to take a very serious look at this, because if you're not addressing value-based care today, or you're getting the tip of the iceberg, this is what our future looks like and what's happening with that. So the benefits of value-based care to the patient, hopefully lower costs and better outcomes. To the provider, increased patient satisfaction and better efficiencies. And hopefully that key thing there is effectiveness and efficiencies, those two words that I talked about a minute ago. The payers, once payers are getting stronger control of costs and reducing their risk, we'll talk about that in 1 second. And then the suppliers, and I think this is important as well when we talk about the cost of drugs and the cost of purchasing the capital equipment, the cost of supplies, the PPE issue we faced over the last 18 months, different things like that. So there are benefits across all spectrums of the healthcare delivery model. And then when we think about this, technology. Well, okay, technology can be a key cornerstone for what's going on. And I think the NextGen folks have some really great opportunities and great things that they're talking about here relative to technology to help you in managing your value-based care program. So if you start out with, give me my costs and help me understand that, then you ask the question, where's this information come from? It comes from the technology that you've had, the decisions that you've made relative to the technology and how that technology is appropriate and effective for you. And again, here's a list of bullet points that I think are really critical for you to think about relative to the technology in the world. We'll kind of finish up with the idea of risk. And the reason I kind of saved this for the end is because this is the scary part. The scary part is that there's really, when you go from fee-for-service to value-based care and hybrid models that are there, there's one-sided and two-sided risk. The one-sided risk means that you will share the benefit of your value-based approach if, in fact, things improve. So things are going to go up, then you'll get the upside of, or get to share the upside. The two-sided risk, on the other hand, is that when you can gain from that initial one-sided shared savings kind of thing, but you also have the risk of being the downside scenario. And there's an oncology to risk model. There's an ERSD two-sided risk model. So there are different things like that that Medicare is pushing and your payers are pushing. But what happens here is that we're really looking at if you don't achieve a goal, then you actually could be penalized. Whereas if on the one-sided risk, if you achieve a goal, you'll get to share the benefit. So as we think this through a little bit more, it's important for you to look at this. And we're obviously going to see more and more shared two-sided risks, even though as over 500 ACOs that are in the marketplace today, about 1/3 of them are doing the two-sided risk. So there are experiences that people have in the marketplace as we move forward and as we look at what's happening. Now, in quick summary, what do? And again, we could have spent the next 2 or 3 hours talking about all of this stuff. So this is quick, hopeful overview that says, learn and know your costs and know how to manage your costs and what costs are involved in that direct care to that patient that's leading to the value proposition that you have for the upside quality and hopefully controlling your downside risk that creates and gives you a total picture of each and every patient experience that you have. So Brian, I think that wraps it quickly for me.
All right, thank you very much, Owen. We appreciate your presentation and your insight. And with that, I will turn things over to Tyler.
Thanks, Brian. And Owen talked a lot about kind of the cost aspects of things, and I want to take a little bit of time to talk about the revenue side of things, your income side of things. I want to talk about some challenges in particular that relate to denials, cost transparency, and then wrap up with a conversation about some tools, in particular from the technology side of things, that's my background, that you can leverage to really maximize some of these things in your favor, as well as some key performance indicators that we recommend you pay attention to monitor these trends. So the first thing I want to talk about is this challenge that we face right now. It's an era of increasing denials, and there's a couple of things contributing to this that I think all of you are aware of, so I won't harp on it for a really long time, but you should be aware of. Payers that you work with, private payers and the government as well, are increasingly relying on automation to drive claims approval and denials. And what this means is that A lot of times you're experiencing an automated rejection or denial of claims that you're submitting because of this technology that practices are utilizing. We'll talk a little bit about how you can combat that in just a little bit. The next is payer complexity rules. More than 46,000 payer rules have been added this year alone, and this year is not unique. A couple of those, a lot of those changes are COVID related, but some of those are just normal federal rule driven changes that you're going to experience every single year. And last but not least, one of the increasing challenges that is impacting denials right now that you're probably experiencing is employee attrition and turnover rates. Some of these definitely amplified due to the COVID-19 pandemic that causes you to experience lost institutional knowledge that can a lot of times minimize the denials that your practice experiences. A lot of times this is being referred to as the Great Resignation. We'll talk a little bit in a minute about the overall impact of this a bit more. The next thing that I want to talk about is cost transparency and some challenges that you're probably experiencing related to this. About 7 in 10 patients right now indicate that they're confused by their benefits or by their medical bills. I'm sure many of you have had an experience where you've walked into a medical practice before and you don't know exactly what you're going to be charged for. What was included as a part of my physical? What tests or diagnostics were done that are not going to be included? About 8 in 10 patients are surprised by medical bills, and this doesn't just mean that they had a medical bill that they didn't expect, like they got COVID and they didn't think they were going to get it. A lot of that is surprise about what the actual medical bill cost. So they knew they went to the doctor, they knew there was going to be a charge associated with it, but why was it $500 instead of $100, or why wasn't this covered under my deductible? And the last is this expectation disconnect. Right now, about 90% of patients really understand what it means to be ready for a procedure, which is to say they show up for an appointment prepared medically. They know they need to show up fasting, but only about half of patients actually know the cost of that procedure that they're showing up ahead of time. Now, what this really is an indictment on how well we prepare our patients for their experience at our practice. We do a really awesome job at getting them ready medically for their appointment, but we don't do the best job at making sure they're prepared to pay for that appointment or for the administrative aspects of that appointment. So what can we do to combat some of these problems? It looks like we have some automation issues. I'll go ahead and advance through some of those. First, I want to talk about denials, and I want to talk about how we can leverage advanced technology and analytics to help us improve these. And the theme with this is really practicing denial avoidance before we practice denial management. Now, certainly you need to have a strategy for managing denials, but I want to talk a little bit about how we can avoid them altogether on the front end so our denial management strategy can be as efficient as possible. First, 2 of the top 3 reasons that claims are denied is that patients are, number 1, not covered, or the service that they're receiving is not covered. So we'll talk a little bit about eligibility in just a moment. And then automation. As we talked about earlier, payers are increasingly using these automated systems to drive approval of your claims and denials. You should use the same strategy to drive how clean your claims are and how prepared your claims are before you submit them. And last but not least, we'll talk about some analytics. So number 1, eligibility verification. Eligibility and making sure patients are actually eligible to receive the services that you're providing with them can go a long way into making sure that you're getting the revenue that you need, both from the patient as well as from the payer. A couple of things that really frame this conversation. Number 1, insurance is changing in our world. Right now, high deductible health plans are more popular than ever before. What does this mean for us? It means that patients are increasingly responsible for more of the bill than the payer is. Right now, we've seen the average deductible increase by about $700 over the last 10 years, and about half of Americans right now are covered by high deductible health plans, where they are going to be the ones paying you at least until they meet a very high deductible, $6,000 or more a lot of times, before that responsibility kicks in for the payer. One thing we know as well is that your chance of collecting payment from a patient decreases by more than half when they walk out the door. So your strategy for collecting payment should involve making sure the patient is eligible for the services they're receiving and knowing how much they're going to be responsible for when they come in for that encounter. So you can collect that payment at the point of care versus trying to collect it after the fact. If you're waiting to collect that money after the fact, your chance of collecting the money decreases drastically. And last but not least, consider the impact of COVID and that unemployment that we talked about earlier, certainly impacting your staffing, but it's also impacting your patients. In the United States, for better or worse, private insurance is largely linked to your employment. About 1 in 4 workers plan to switch jobs once the pandemic threat subsides, and this means their insurance will be changing as well. So ask yourself, what steps are you taking to maximize cost transparency to a patient? If they've changed insurance providers, likely their coverage has changed and their eligibility has changed. So we recommend making sure you're confirming that insurance, confirming that eligibility on the front end to avoid denials on the back end of things. So a couple of advanced technology solutions you can leverage to make sure we're doing this. Certainly, you should be checking eligibility through an automated system before patients come in for an appointment. We recommend doing that for all scheduled appointments, but also leveraging the ability to complete those in real time for a specific procedure. So if you have a patient in your clinic, you can see, well, are they eligible for what we're recommending that they do right now? And then last but not least, consider crafting your patient engagement strategies to make sure that you're taking care of this in the most efficient way possible. So before the encounter, making sure we're getting updated insurance information in particular, because that's changing for lots of patients, as we discussed, and you're setting cost expectations as necessary. During that encounter, making sure that you understand and you're providing that cost transparency. What do you intend to bill separately? What's going to be included and not included for a patient? Are you taking care of labs and imaging and diagnostics outside of a standard E&M service? And then after the encounter, of course, you're always going to have these situations where you're going to have to bill for something after the fact. We don't live in this perfect world where it's all going to be able to be done before or during the encounter. To provide transparency and statement clarity and easy way for patients and payers to remit payment to you. The next thing that I want to talk about is leveraging advanced technology to review your claims. Earlier, I mentioned that payers are now utilizing advanced technology to deny your claims, so I recommend that you use advanced technology to review your claims before you submit it. So all of you are likely looking at your claims with a fine-tooth comb before you submit them, but if you're not already leveraging some type of automated solution, some type of AI, for example, to review your claims for comparison against your payer rules, against CMS rules, you should be doing so. A lot of the benefits of these types of systems allow you to leverage an entire cloud worth of rules to compare your claims against and make sure they're clean. They automatically are updated with new rules from payers or CMS, and they allow you to configure flexible options for your practice in order to create specific rules, specific screening tools related to specific locations or even specific providers that can help you make sure your claims are as clean as possible and all your I's are dotted, your T's are crossed before you submit those claims to a payer. A few statistics here that really drive home the importance of making sure we're doing this work on the front end. Excuse me, I advanced too far there. Is the cost of working denied claims about $25 per denied claims, and about 50% of claims right now in our industry don't get reworked. A lot of times that's can certainly be because the value of the rework claim is not worth the time and effort that it takes to put into it. But a lot of that is due to a lack of time and a lack of knowledge. So what are we doing and what are you doing in your practice to address the lack of those two things? And certainly leveraging these automated systems and doing preventative denial avoidance can help regain some of that lost time. A quick case study that I want to draw your attention to with utilizing this advanced technology to review claims looked at an implementation of this with about 1,600 providers. And in that implementation of about 1,600 providers, about 8% of claims of 48,000 total encounters were caught, reviewed, and corrected before getting denied and getting returned. So what we see in this is utilizing this type of technology certainly allows you to avoid running into some of these issues on the front end and causing those delays in your AR on the back end. So we do recommend you utilize these tools. The data proves that it does help you reduce denials and overall increase the efficiency of your revenue cycle. The last thing that I want to talk about is important and meaningful analytics. Structured data is incredibly important, and it's important for a couple of reasons. In order for you to be able to track these trends in your data and your practice, you need to be able to have the transparency and the clarity into your outcomes. Certainly your clinical data and being able to renegotiate contracts, especially in value-based care arrangement, is incredibly important. But it's also important for you to be able to report on data more generally. So make sure you're documenting things in structured and standardized and effective ways in order to be able to produce data in order to kind of show these serial trends over time. And last thing I like to say is to run your practice, not report. So I encourage you to leverage analytics platforms to provide actionable data synthesis in a timely manner and to avoid data silos. Right now, if you're doing a lot of manual data synthesis and combining of data, that works, but a lot of times it takes you so long to synthesize that data and combine it that the data that you synthesize is old by the time that you have it in order to review. So leveraging a technology solution to provide you with that data synthesis and the drill down capabilities can go a long way into making sure that you understand those key performance indicators that will allow you to improve. So the next thing that I want to discuss is what those key performance indicators are that we recommend that you track. And we largely put these into a couple of buckets. And the first one that I want to talk about is revenue leakage metrics. And I put 6 examples of revenue leakage type metrics on the screen. We recommend you track these, and certainly specific things that you may want to pay attention to within these categories can vary by specialty or different things like that. But certainly overall, your value and volume of denials, your no-show appointments, your patient engagement strategy, and having open appointments at the last minute is certainly a way that revenue leaks out of your practice. So what are you doing to avoid those types of things? Your measure of new versus established patients, and what patients are you billing as established patients that may be eligible to be billed as new? That is a way that revenue leaks out of our practice, and we'll talk about that a bit more in a moment. And then last but not least, I talked about eligibility checks earlier. At face value, that type of metric, what percentage of patients are we confirming eligibility for, can seem a bit more benign, but it does create a trickle-down effect where eligibility, more patients that you confirm are eligible, you know you're going to get paid for, you get paid quicker. So it's an important metric, a really early indicator at how well you're doing to protect your efficient revenue cycle. So I want to highlight a few of these specifically. The first one that I'll highlight is denials of value and volume. The MGMA estimates that the average practice spends more than $30,000 a year reworking denied claims. So that really drives home the importance of those that denial avoidance strategy that I talked about earlier. But it's important as well to track these denials by a couple of categories so you can see what your problem really is. Do you have one problem coder, if you will, on your staff that you really need to retrain? So you can look at denials as a function of your employees and your team that are entering those. Do you have problems with a certain payer only? So we need to revisit a contract with that payer or a workflow concern with that payer to make sure that we're able to get those down. Are they all getting denied for the same reason? All of these things can really help you identify a trend and then attack those accordingly. And then last but not least, remember that not all codes are created equally. So for example, you may have a lot of volume with denials of one code, but the value of other codes that are denied may be far more. Like for example, J-coded drugs that are worth a lot of money. So be strategic about which denials you want to go after as it pertains to the value of those denials, which ones are going to be easiest for you to get back in your win column. The next thing that I want to mention is a kept and no-show comparison. This is one that can easily fall by the wayside, but it's something you should pay attention to. If your patient engagement strategy is causing you to lose a lot of appointments and not get these in the kept appointment column, then you really need to rethink how you're engaging with your patients, maybe by different appointment types. Maybe we notice that a certain type of appointment is not showing up prepared for the appointment, or they're falling behind and having a lot of no-shows and cancellation. Change the way that you engage with those patients before the appointment to make sure that you don't have those last-minute vacancies in your appointment book, that white space showing up in your appointment book where you could have revenue producing encounters. And then we talked about this as well, and this is new patients versus actual new patients. Keep in mind from a billing standpoint, and this is not always true, but can be a lot of times, if a patient has not had an appointment with you in 3 years, then that patient may qualify as a new patient again and could be billed at a new patient rate. So monitoring this type of metric can really show you some revenue loss, some revenue leakage, if you will, that your practice is experiencing by identifying patients who may qualify for that higher billing rate that you're not actually billing them for. And then last but not least, as it pertains to revenue leakage, we talked about the percent of your appointments with a prior eligibility check. Again, framing this one as a function of the fact that lots of patients right now have new insurance, and you're going to need to make sure that they're eligible to receive the care that you're providing to both protect your revenue and your income, both from the patient as well as from the payer. And the last one that I want to mention is a payer analysis. So I do recommend that you look at an analysis of where your money is coming from as it pertains to payers, as well as your code distribution with these payers. That way you're able to renegotiate contracts as it is strategic or beneficial for you, as well as pay attention to denials that are coming from each of these payers. So monitoring your income as it pertains to which payers they're coming from, and then being able to slice and dice these as it pertains to codes, denials, and visits that are going to each of these payers is incredibly important as well. The last thing that I want to wrap up is just with a quick analogy. A lot of the changes that we're recommending that you make or that you need to consider as it pertains to cost and revenue, some of them can be very quick, and I like to think of that as like changing directions on a jet ski. You can make a quick change, and you can easily go a different direction and realize instant improvement or instant change. But a lot of the things we're talking about today are more like changing the direction of a cruise liner or an aircraft carrier. And you're going to need to make small changes that you're going to realize over time. You can't change the trajectory of that overnight. You're not going to notice it within the first couple of days. But at the end of the day, a lot of the changes that you're going to make are going to lead to drastic improvements in your revenue cycle over time. So I encourage you to consider what are those things that we're going to realize over time. What are the things that we can do tomorrow to make positive changes, both on our cost side of things and our income side of things, to really improve our overall financial situation. With that being said, I'll turn things over to you, Brian.
Tyler, thank you so much for your presentation. A lot of really valuable insight in there. And then I will now turn things over to Mark, our final speaker.
Thanks, Brian. Great presentation here. And my approach right here to the audience, and what I want you to get out of this is I want to dig deep into a potential scenario. So if I were to show up at your practice today and start shadowing your staff in the revenue cycle from patient registration all the way to charge capture and charge entry, and I ask the question to your staff, why are you doing what you're doing the way it is? Would they say to me, well, Mark, that's the way it's always been done? Or maybe they'll say to me, this is the way management said to do it. The reason why I ask these questions is because my approach to this situation would be, how much opportunity is it in your organization to cut wasteful activities that are not contributing to your overall revenue cycle goals in your organization? Too many times I run into this where people are just doing very busy work that does not contribute to getting paid and getting paid quickly. So I challenge the practices and the clients that I work with, hey, look into your organization's business operations and let's take a look at what work we can automate. What if-then statements can create through automation to take away that busy work so your staff can be freed up to focus on the strategic initiatives of your practice. And more often than not, you can cut waste versus going with the other approaches, what can we get more out of our staff? So I challenge you, look through your revenue cycle, shadow the staff. That's what we do at NextGen. What can we do with your policies and procedures to simplify them, to streamline them, so that they're working faster for you? The other thing I want to talk about, and it's been touched on here today, is payer representation partnerships. What does that partnership look like in your organization to your top payers? Do you really know your contracts? And I'm not talking like, yeah, we just renewed, we got a good rate, but do you really know what you're getting out of that payer? And what does that partnership look like? I'm going to be diving into a little bit of a dashboard that I've used in my time here at NextGen, as well as when I run business offices, that really gauges the performance of your payers and how they're performing for you, and how you can leverage that data in negotiations, in your payer representation meetings, to get more from your payers. So that's more of a partnership than something where you're trying to fight to get every penny. The next part I wanted to talk about is incentivizing top performance. Does your organization track what top performance looks like? And do you incentivize that work? For example, I've worked with a lot of clients in NextGen of ours where they're trying to incentivize at least quarterly or on an annual basis for accurate work that's hitting a certain performance benchmark. What's really important to know here is, does that staff know from your front end to the back end how their work contributes to the strategic overall performance of your organization? More importantly, do they know why they do what they do and how it affects everything downstream? The more they know about this, the more impactful they can be in your organization, and you should incentivize that performance. And finally, when all is said and done and you've really dug into your business operations, now it's time to look at, all right, what technology partners can we contact or potentially partner up with that can help us hit these goals? And usually that's the last thing I like to look at, because first we need to clean up business operations so that you do have the resources and time to maximize what that technology can do for you. A lot of times I run into it and it's the clients are only using, the bare minimum of that technology. And you have to ask yourself, well, what more can you get out of your current technology that you may not be leveraging? Now, part of this presentation is about transparency of cost. Really, that data can help you drive a lot of financial decision making. So if I were to ask you today, do you know what it costs to submit a claim, or how much cost there is into working a denied claim? And a lot of things that we see here at NextGen is people don't have the tools to track that. And one of the things we do is we look at denial recovery. And if I was to say to the client, hey, listen, you have $100,000 in denials a month, you're recovering $60K. Do you know if you're breaking even on that $60K? Are you spending more in denial management activities to get that money? Because if you are, we need to look at a better way of doing it so you're profitable. Another way to look at it is, how many FTEs do you need to hire to get that business activity done? If you can compare FTE to FTE and what work each one does, is one doing more? Is one doing less? And do you know why? Does that person not have the training? Are they being underpaid, overpaid? What's the morale of that FTE? Also, if you were to bring in a new provider to your organization, and I ask this question a lot to my clients, is, all right, what's the target in encounters being billed and revenue that we need to do for you in order to break even? And many times they don't have that answer. Very important to know what you need to get in order to sustain that service in your community, that your patients can get the services they need when they're sick. Too often do we run into that they don't have enough money coming in for that specialty, and they have to maybe cut it or outsource it or refer out for it. And too many times that's a missed opportunity to create a very loyal patient to your practice. Also is, how much of the cost in your organization and your business office is directly impacted on your margin? A lot of times this is where you can really get into the numbers and know, hey, listen, are we going to break even? What do we need to do in order to turn a profit in our accounts receivable activities? And finally, how much does it cost to get a new patient? Like, how long does it take for your patient to call you and get in the door? And how much money are you losing potentially from it being too long? These are a lot of questions I want you to take away and ask and say, are we tracking this? How are we tracking this data today that we can put it into a format where we can drive serious, quick financial decisions that can have a significant impact, not only our organization, but the community that we live in? We do a lot of dashboards. Everybody's got a dashboard, right? If you don't have a dashboard, this one I just kind of conjured up using Excel. There's a lot of different tools out there. And maybe you do have a dashboard, and you are tracking these things. But my question to you is, what are you doing with that data? Are you taking that data back into your organization and sharing it with shareholders in multiple different departments that can drive change? You got to really get buy-in and start picking the right metrics. There's so many that we can pick today that can really, really make an impact. But what are the ones that matter to you? Too often I see that there's too many metrics that you're tracking, and there's a huge law of diminishing return. Pick a strategic initiative, 1, 2, 3 things that you want to accomplish in the next fiscal year, and then drive it with a dashboard in a group that can help you drive the change in your practice. Now, shifting gears, back in my business office days when I've run business offices for physician groups, I also used to do the payer negotiations. And I never really had the data I needed to get into that negotiation and kind of leverage what we're doing for the members of that insurance company. And I challenge you to build a payer dashboard. And it could be as simple as just tracking all your AR metrics, but broken down into all your top payers, and then comparing them against each other. Because then when you go to the negotiation table, you have something in your pocket to say, hey, listen, it costs more money for me to submit a claim to you than anybody else. And here are the 3, 4 business problems that we have with your organization. How can we work together to make this easier for our patients and your members to get the services they need in a quick and timely fashion without problems? Because I can say, if it's difficult to work with that payer, if it's difficult to schedule an appointment and get in the door, your patients could have a very high dissatisfaction level. And track those things, and here's why. I've brought that type of information to a payer negotiation. And if you have the right person in the room, they're going to love that you're digging into this data because they want to use it to help them grow their membership. And you can be involved in that. And when you get involved in that, you can have better leverage for reimbursement. So take a dashboard, take some metrics, look at your performance and look at your payers, and start with a committee or a revenue cycle integrity committee that meets and talks about this and strategizes at least 1 to 3 things that you want to do in the next fiscal year to get a really good financial outcome, but also a patient satisfaction outcome. I love bringing on new clients. I love looking at all their data, and I love helping them in this way to really get them to think about how they can make an impact in their organization. One thing I like to look at is something that we're looking at here today. I just call this your payment lag. As you can see with charge creation, I challenge the clients. I say, well, how long does it take for your provider to close that encounter and for your business office to create that charge? What's the time frame between that data service and when you create that charge? As you can see here in orange, that's charge creation lag. The next thing I challenge is, once you've created that charge, how many problems are you having with that data? Is it bad? How long is it going to take you to get it out the door into a billed status, as you can see here with encounter billing lag? And then the third piece to this lag payment metric is, how long does it take for you to get paid once you've submitted that clean claim to your payer, and what's the turnaround time for you to get that money? That's what payment lag here is in the purple. And then add it all together. And this is where I use with my clients, and I was just showing this yesterday to a CEO of a 14 provider practice down in Texas, and he said to me, Mark, every time I meet with you, Mark, I just have more questions. And I laughed, and I said, that's good. I go, you need to ask these questions, because when you have peaks and valleys, there's something behind that that's driving it. And when you get down deep and find out why, you can mitigate those risks for the future so that these lines stabilize in your revenue cycle. And that's what it's all about. Now, I don't have much time. I'm going to be ending it right here, but a little bit more about me and what we do here at NextGen. We do offer RCM services to our NextGen clients. And we have a lot of different specialties that focus in this area, and we love helping people with their practices, with their revenue cycle. That's my email on there. Drop me a line. Love to hear from you. Love to see what's going on in your practice. Love to help in any way. But anyway, that's all I have, Brian. I'm going to switch it over to maybe questions.
All right, thank you, Mark. And also thank you to Tyler and to Owen for your informative presentations. We're now going to move on to the Q&A portion of the webinar. If you haven't already, you can submit your questions using the Q&A tab that is all the way on the left side of your screen. We will work to get as many questions answered as possible until we reach the top of the hour. I think the first question that we got is related to, I think, something that, we talked a lot about managing denials as one way to, help bring, ensure that more revenues getting and charges are getting billed in a more timely manner. But we know this is a challenge for a lot of practices. And are there other ways to try and speed up the process of getting charges billed in a timely manner? Owen, I'll start with you, and then others can chime in.
So you want to start with me? That's an interesting point. I thought that Tyler was the best one to deal with denials. Okay, well, my point, the big point that I would have with denials is that they're very expensive, and I like the acronym DIRFT, D-I-R-F-T, do it right the first time. So if you've got denials and you manage your denials and you take a look at them, find out the reasons why they're being denied and what can you do internally to improve and to fix your denials. So I really think that's an important aspect of how you manage and deal with the cost of dealing with the denials.
All right, Tyler?
Sure, and outside of the context of denials, I would really lean on a lot of the guidance that Mark was providing, which is really analyze from start to finish with your workflow where some of those hangups may be getting closed or may be happening. Is it that your providers and your clinical team aren't completing documentation in time to get billing out? Is there some sort of hang up with the coding process from encounter date to charge entry date, charge creation or submission date that is your big lag time? So there are lots of places where holdups, bottlenecks, and funnels can occur, and that can be very different for different practices. So I encourage you to take a look at where those are happening for you and make sure and use appropriate strategies accordingly.
Okay. I wanted to roll into our next question, which is, I think, one that's sort of very prescient. I know you've both touched on this, all three of you have touched on this. A lot of practices are facing pressure to keep clinical costs in check. How do you have any recommendations for how to assess those costs and look for opportunities to make changes that aren't going to impact care quality, and at the same time we're going to be mindful of the fact that, as I think Tyler pointed out in particular, a number of patients might be facing challenges in making payments?
I guess if that's directed at me, this is Owen, and the most critical thing that you have to do is to really gain that understanding of what your costs are, and then look at what those cost benefits are to it. What we find is, for example, everybody says, well, we got a lot of overtime, so let's cut overtime. Well, then 6 months later, the same question comes up, let's cut overtime. So I think it's a matter of defining what you're really doing, what your purpose is, identifying what your major costs are. And obviously the biggest cost we have is staff, so that's where we start. But we can gain a lot by more effectively utilizing staff. And potentially we could shift staff around from areas where they're not necessarily contributing directly to the overall operation, and be able to then use their talent and resources in other areas. And then obviously as I mentioned in my discussion earlier, your fixed costs, leave those alone unless it's time for you to renew your lease or take a look at your malpractice agreement or something like that. Instead, look at those indirect and look at those variable costs that are outside of staffing and see where and what can be done to manage them. And do you need to, unfortunately now we probably need an inventory of PPE, but do we need an inventory of other things? And so how have we actually looked at and what has our data told us are the areas where we're outside of the benchmarks. And I think Tyler commented on MGMA, and MGMA has some great data looking at cost per provider, cost per square foot, different kinds of things like that. So there are benchmarks that are available in addition to your own internal benchmarks that you've had year over year over year.
Knowing that we just have a few minutes left, I wanted to start kind of flying through this one a little bit. We'd had a question come in about benchmarks, and I think, Owen, you were able to address that very nicely. One key question that I think is definitely worth looking into, this being, the Q4 with a little bit more than 2 months left in the year, we had a question come in about what should the revenue cycle management folks be focused on, as the year is wrapping up? What sort of priorities should they be setting? Are there specific cost figures they should be looking at, or revenue targets they should be addressing? Do any of the three of you have thoughts on where RCM folks should be setting their priorities with a couple months left in the year?
Yeah, Brian, this is Mark. The most important thing to do right now is get all your stakeholders in a meeting and look at, what should we be focusing on strategically for the next fiscal year that is going to be our goal or target. But more importantly, how are you going to measure that is where I wanted to go with this. And so breaking that down into any type of goals, benchmarks, targets, and then how you're going to be measuring yourself to hitting those targets, including, but not just looking at the financial goals, like the revenue goals, but the cost goals as well, creating a budget or a plan around that to say, how much are we going to invest to get this type of output out of our staff? I think that's really an important goal. The other thing I would like to touch on, and I think we were talking about that, is with the patient financial services and making sure patients understand, the financial impact of a lot of the clinical decisions, as well as I would like to see a lot more investment into the customer service and make it a better patient experience for your patients at your organization. There's nothing more frustrating than going through a really dissatisfying healthcare experience at an organization, because that will cost you a lot of money because you'll never potentially see that patient again. So are you investing in some tools that can create a better experience for your patient? And I got to tell you, I've seen a lot of studies in these last couple of years where the patients actually, it's more important to them to understand the financial impact of the clinical decision than what their doctors, MD, what college they went to. So are you able to understand what your patients want from you in the next fiscal year to work on through at least maybe surveys or any type of like email communication to get them to tell you what you should be working on? Is probably the easiest way to go to create a strategic plan for fiscal year 2022.
Right. Yeah, that's great. I know we have a couple minutes left. I wanted to make sure we could get to a couple questions that came in through the audience. I know we talked a little bit about sort of looking at, sort of monitoring the payers you're working with. We had a question come in that I thought was interesting, which was, should a practice be formally monitoring the quality of its referral network, specifically when we start looking at, these ideas of bringing in revenue and also sort of limiting costs? Do we have any thoughts on that from anyone? Tyler, I'll start with you.
Yeah, sure. I'll open that up. And I actually think Owen highlighted this when he spoke earlier. I would definitely recommend monitoring the quality of your referral network if you are, in particular, in a primary care space and you are in a value-based care arrangement where you're being attributed patients from a cost standpoint. And care is being provided by someone you referred them to. And at the end of the day, in that cost arrangement, that value-based care contract, ACO that you're involved with Medicare or otherwise, is falling on your shoulders. So definitely more so in some cases than others. But if you are being attributed patients from a cost standpoint in a value-based care arrangement, and the cost of that referred care is ultimately going to be pinned on you in a value-based care situation, you certainly should be monitoring that.
Owen, did you want to add anything?
Yeah, I think that is absolutely on point, Tyler. But I also just say, not only from a value-based care modeling, but also take a look at if you're a specialist and you're getting referrals from the primary care model or the other way around, simply looking at the type of patients that you're getting. Are they complex patients? Are they poor payer patients, or patients that are subscribed to poor paying contracts and different things like that? So I think it's essential to look at your referral sources from all different aspects as to how they impact your costs directly to you, and then indirectly, as Tyler has so well pointed out, within the value-based payment model.
All right, that's great. Thank you. One question that came through is, and we talked about, the importance of looking at claims prior to submission in order to reduce denials. We had a similar question come in regarding prior authorizations, which is something I think a lot of practices may be struggling with. Are there either steps to be taken or tools that can be used to help get those, ensure the right authorizations are in place before claims are submitted to, again, sort of reduce those denials and bring revenue more quickly? Tyler, I can start with you, I think, for this one.
Yeah, sure. I'll start with that one. The technology solutions that I mentioned earlier, as far from a eligibility standpoint, we see a lot of our clients and a lot of practices utilizing from a prior authorization standpoint as well. So leveraging seamless workflow within your EHR to identify patients that need prior authorization based on the procedure that they're scheduled for, the visit that they're scheduled for, and then forwarding those in an automated way, integrated way, interfaced way to whatever vendor that you're utilizing for prior authorizations can really drive a lot of efficiency around that process and make sure that you're identifying patients who need that, and then you're getting it in an efficient and quick amount of time.
Okay. I'm going to squeeze one final question in, which is one. Listener wondering if we've seen cost pressures, supply chain, or inflation. Is this something that you've seen experiences, and if so, is that something to start to be incorporating into some of their longer-term planning, whether it's with PPE or with their care or services or their supplies?
And Brian, I think we lost some of your connection there, but I think the overall question was, are supply chain issues and kind of inflation impacting cost pressure? And the answer definitely is yes, certainly from a supply standpoint. But one of the biggest supplies you have, of course, is your staff and employees, and we definitely see trends there increasing in cost as well. So the short answer is yes. I know we're short on time, but it should motivate you more to look at your contracts with drug vendors and supply vendors, et cetera.
Okay, thank you, Tyler. Appreciate that, and apologies for missing you there. I want to thank everyone for attending this Fierce Healthcare webinar and submitting their questions and tuning in up to the very end. I'd like to thank each of our speakers for participating, and I'd like to thank NextGen Healthcare for presenting today's webinar. That will conclude the webinar, and it has now been recorded. You will be able to access this recording within 24 hours. You can use the same audience link that was sent to you to log into the webinar today. And with that, thank you again for joining us, and we look forward to seeing you at a future event.